Motion sickness is very common. 1 in 3 people are considered highly susceptible to having motion sickness. Whether that is traveling by car, bus, plane, train, ship, and even if you're an astronaut, we all will eventually experience some type of motion sickness. And in this video, I'll share with you the best ways to prevent motion sickness and treat it all together. So stay tuned until the end. So the reason why we get motion sickness, seasick, or car sick, or whatever you want to call it, is because there's a mismatch in signals about movement coming from different parts of our bodies. For example, if we're focused on a still object in a moving car like our phone or a book, the signals from our eyes and our brain are telling us that we aren't moving and we're actually still, while our balancing mechanisms in a moving vehicle are saying we are moving and that we aren't still. These conflicting messages are what progresses into motion sickness, causing dizziness, sweating, nausea, and vomiting. So before we look at the treatments, these are my best tips to preventing motion sickness. Number 1, positioning in a vehicle and where you sit matter. If you're on a ship or a boat, choose a cabin in the middle of the ship and near the waterline. If you're on board, go up on the deck and focus on the horizon. If you're on a plane, the middle of an airplane over the wing is the calmest area of the airplane, as the degree of motion is the lowest here. Also, directive air vent to blow cool air on your face, as this can help too. If you're on a train, always face forward and sit near a window. If you're on a car, sit in the front seat. If you're a passenger, look at the scenery in the distance. And for some people, driving the vehicle instead of being a passenger is an instant remedy. Other tips are making sure you never sit facing backwards from the direction of travel. Number 2, do the following. Get plenty of rest before you travel. Being overtired can make you more prone to motion sickness. Drink plenty of water to stay hydrated before your travels. Stand up if you also feel queasy and look over at the horizon. Number 3, avoid the following. Greasy and acidic foods before travel, smoking before or during travel, reading or looking down at your phone while traveling. And as far as treatment goes, antihistamines are commonly used both to prevent and treat motion sickness, so you could use them for prevention purposes too. I recommend trying the over-the-counter Bonine for prevention and treatment. Even though its side effects can be drowsiness and dry mouth like most treatments for motion sickness tend to cause, Bonine makes you feel less drowsy than Dramamine, and it lasts longer as well. Take it 1 hour before your travel starts and avoid alcohol while using the product, or 1 to 2 tablets once a day or as directed by your doctor for treatment. Keep in mind that Dramamine for kids, a separate Dramamine product, is the only medicated motion sickness relief formulated just for children ages 2 to 12. So reserve that one just for the kids. Another product I would recommend asking your doctor if it's okay is the Dramamine non-drowsy formula containing the clinically tested ginger dosage required for preventing and treating motion sickness. Ginger can interact with blood thinners, which is why I advise seeing if it's okay first with your doctor. I made a whole video about the scientific profile of ginger, so click here to watch that. Keep in mind that the research is still not conclusive. What others say works for them, totally anecdotal and very little evidence backs them up, are the acupressure bracelets, which applies pressure on your Niquan acupressure point, which is believed to be a way to remedy the feeling of nausea and motion sickness. They take up to 2 to 5 minutes after putting them on to be effective, and may only be effective if you actually believe them to work. I'll leave a link for them in the description below if you still want to try them out. If your job requires you to travel a lot and you feel motion sickness frequently after all these tips have been applied, or let's say if you feel anxious before trips and this stops you from going out and seeing the world, make an appointment with your doctor, as you may need a prescription treatment for motion sickness such as scopolamine, oral pills, or patches, which has been effective for most. If you have any tips and tricks that have helped you, please write them down in the comments below. I usually get really bad motion sickness on boats, so I'd love to hear what has worked or not worked for you guys. Like this video now if you thought it was helpful or useful in any way. Subscribe to stay on board for more videos like these, and as always, see you on the next one.